Health Secretary Jeremy Hunt has admitted the social care system is under unprecedented pressure as BBC London learns that an increasing number of care homes appear to be cherry-picking the patients they take in. A lack of funding and increasing demand for places means those who need the most care are sometimes being overlooked and rejected. Well, a graphic designer from East London believes his mother wasn't able to get a place in a home because of the amount of care she needed. It meant he had to put his life on hold. Helen Mulroy reports.
Back to work for Alex Turner. It's been a long time coming for the graphic designer after he was forced to take a career break at just 26 when his mum Sue was diagnosed with early onset dementia.
I'd get 5 or 6 phone calls a day. Members of the public would find her, or the police would pick her up, or she'd be in hospital, different hospitals around our area, and I'd have to go and collect her a lot of the time. And when she was living at home, there'd be different carers every day. She wouldn't want to let them in. They hadn't been trained as to how to do that. So full-time jobs were impossible.
Alex became his mum's main carer, even living with her for a period of time. But her condition worsened and she went into hospital. By then it was clear the only option was a care home. For the next year, Alex looked at over 20 homes and applied for a place at more than 10 of them. But at each one, after assessing Sue, who was still relatively young, physically fit and mobile, none could offer her a place.
It was really depressing and demoralising, and I felt really unsure about where she was going to be going, and it wasn't a nice time.
Sadly, Alex and Sue's story is far from unique.
Alzheimer's Society's helpline increasingly gets calls of this exact nature. We're finding that care homes are picking and choosing the people that they accept into their homes, largely because they don't have the funding to be able to provide the specialist support that is needed to help somebody with dementia. With the national living wage is going up soon, the property and the upkeep of that property, particularly in London, that can be extremely expensive.
In contacting the government, we asked the Department of Health and Social Care what they're doing about the lack of appropriate care home places. They told us that they've invested an extra £2 billion in social care and that over the summer they're publishing planned reforms to make the social care system more sustainable for the future. But for Sue and Alex, any such reform is too late.
I'd missed a chunk of my career. I just couldn't get a job. My mum wouldn't have been happy about that. I think this would have been the main. It would have been incredibly upsetting for my mum to know what I've gone through.
Helen Mulroy, BBC London News.